Norel Ad is a combination medication used to temporarily treat symptoms caused by the common cold, flu, allergies, or other breathing illnesses such as sinusitis and bronchitis. It helps relieve stuffy nose, sinus, and ear congestion symptoms, as well as watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. It contains a non-aspirin pain reliever and fever reducer. It's important to note that cough and cold products should not be used in children younger than 6 years old, unless specifically directed by a doctor. Some products are also not recommended for use in children younger than 12 years. It's important to carefully follow all dosage directions and not use this product to make a child sleepy. Always consult with a doctor or pharmacist for more details about using this product safely. Also, do not give other cough and cold medication that might contain the same or similar ingredients without checking with a doctor or pharmacist first. When taking Norel Ad, always follow the directions on the package label or as directed by your doctor. You can take it with or without food, but if you experience stomach upset, taking it with food or milk may help. Make sure to drink plenty of fluids to help loosen the mucus in your lungs. If you are using the liquid form, be sure to measure the dose carefully with a special measuring device/spoon. Do not use a household spoon. If it is a suspension, shake the bottle well before each dose. For extended release capsules, swallow them whole and do not crush or chew them. The dosage is based on your age, medical condition, and response to treatment, so do not exceed the recommended dose or frequency. And remember, do not give medications labeled for adults to children. If your condition persists for more than a week, worsens, or is accompanied by symptoms like a persistent headache, rash, or fever, consult your doctor. Depending on the symptoms you are treating, you may need to contact your doctor earlier than 1 week. Always check the package label for specific instructions on when to contact your doctor. Some common side effects of Norel Ad include drowsiness, dizziness, blurred vision, upset stomach, nausea, nervousness, or dry mouth/nose/throat. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed this medication, it's because they believe that the benefits outweigh the potential risks. Most people taking this medication do not experience serious side effects. However, it's important to seek immediate medical attention if you experience any serious side effects, such as mental/mood changes, shaking, trouble urinating, fast/slow/irregular heartbeat, or seizure. In rare cases, a serious allergic reaction may occur, with symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to remember that this is not a complete list of possible side effects, so it's essential to contact your doctor or pharmacist if you notice any other effects. Norel Ad contains acetaminophen, which can cause serious liver disease if taken in large amounts. Adults should not exceed 4,000 milligrams, 4 grams, of acetaminophen a day. It's important to note that people with liver problems and children should take less acetaminophen. Also, do not use any other medication containing acetaminophen without consulting your doctor or pharmacist first. Acetaminophen is found in many non-prescription and prescription medications, so be sure to check the labels on all your medicines. If you suspect an overdose, seek medical help immediately, even if you feel fine. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, yellowing of the eyes/skin, and dark urine. Additionally, it is advised to avoid alcohol while taking Norel Ad, as daily alcohol use, especially when combined with acetaminophen, may harm your liver. Before taking Norel Ad, it's important to let your doctor or pharmacist know if you are allergic to any of its ingredients or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's best to talk to your pharmacist for more details. If you have certain health conditions such as breathing problems, diabetes, glaucoma, heart problems, high blood pressure, kidney problems, liver disease, seizures, stomach/intestinal problems, overactive thyroid, or urination problems, make sure to consult your doctor or pharmacist before using Norel Ad. Norel Ad may cause dizziness, drowsiness, or blurred vision. It's important to avoid alcohol or marijuana while taking this medication, as they can increase these effects. Be cautious when driving, using machinery, or doing anything that requires alertness or clear vision. Avoid alcoholic beverages and talk to your doctor if you're using marijuana. Some brands of Norel Ad may contain sugar, alcohol, or aspartame. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, or any other condition that requires you to limit or avoid these substances in your diet, it's important to ask your doctor or pharmacist about using this product safely. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Children and older adults may be more sensitive to the side effects of Norel Ad, so it's important to be aware of potential symptoms and risks. For pregnant women, this medication should only be used when clearly needed, and it's crucial to discuss the risks and benefits with your doctor. Similarly, if you're breastfeeding, consult your doctor before using Norel Ad, as it may pass into breast milk and have undesirable effects on a nursing infant. It is important to be aware of potential drug interactions with Norel Ad, as they can change the way the medication works and increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Norel Ad include ketoconazole and levoketoconazole. It is important to avoid taking MAO inhibitors with this medication, as it can cause a serious and potentially fatal drug interaction. This includes medications such as isocarboxazid, linezolid, and phenelzine. Most MAO inhibitors should not be taken for 2 weeks before treatment with this medication. Be sure to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. It is also important to check the labels on all your medicines to avoid taking multiple products with the same or similar ingredients, as this could increase side effects. Avoid using other antihistamines applied to the skin in conjunction with Norel Ad. Additionally, Norel Ad may interfere with certain lab tests, so be sure to inform lab personnel and all your doctors that you are using this medication. As always, consult with your doctor or pharmacist for the best timing and daily dosage for Norel Ad. If someone has taken too much Norel Ad and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 right away. Otherwise, contact a poison control center immediately. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, agitation, confusion, flushing, hallucinations, yellowing of the eyes or skin, dark urine, and seizures. In children, excitement may occur first, followed by loss of coordination, drowsiness, loss of consciousness, and seizures. Make sure to keep all your medical and lab appointments while taking Norel Ad. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. It's important to stay on top of these appointments to ensure you are getting the most out of your medication. If you are taking Norel Ad on a regular schedule and forget to take a dose, take it as soon as you remember. If it is close to the time of your next dose, then just skip the missed dose and take your next dose at the regular time. Do not take double the dose to make up for the missed one. It's important to store Norel Ad at room temperature, away from light and moisture. Be sure not to store it in the bathroom and avoid freezing the liquid form of this medication. Keep all medications out of reach of children and pets. When it comes to getting rid of expired or unused Norel Ad, don't flush it down the toilet or pour it into a drain unless specifically directed. Instead, consult your pharmacist or local waste disposal company for the proper way to discard this product. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.